Basal cell carcinoma, the most common cancer in the world. Cause: develops in the basal cells of the skin's outer layer, almost entirely driven by cumulative sun exposure over decades, which is why it typically shows up on the face, ears, and neck. Symptoms: a pearly or waxy bump, a flat flesh-colored or brown scar-like lesion, or a sore that bleeds, crusts over, and never quite heals. Survival rate: when treated, the 5-year survival rate is close to 100%. The real danger isn't death, it's neglect. Left untreated for years, it can grow deep enough to damage surrounding tissue, nerves, and bone, requiring far more invasive surgery than if it had been treated early. Squamous cell carcinoma, the second most common skin cancer. Cause: also driven primarily by cumulative UV exposure, but slightly more aggressive in behavior than basal cell carcinoma. Symptoms: a firm red nodule, or a flat lesion with a scaly, crusted surface that may look like a rough, stubborn patch of dry skin. Survival rate: caught early, survival exceeds 95%. The cases that turn dangerous are almost always the ones ignored for years. A rough, scaly patch dismissed as just dry skin until it's grown large enough to invade deeper tissue. Melanoma, far less common than the other two skin cancers, but responsible for the large majority of skin cancer deaths. Cause: develops in melanocytes, the pigment-producing cells in skin, strongly linked to UV exposure and blistering sunburns, especially in childhood. Symptoms: a new mole, or an existing mole that changes, remembered by the ABCD rule: asymmetry, border irregularity, color variation, diameter growth, and evolution over time. Survival rate: around 94% when caught while still localized to the skin, dropping to roughly 30% once it spreads to distant organs. That gap usually comes down to a single early skin check. Breast cancer, the most commonly diagnosed cancer in women worldwide. Cause: begins in the cells of breast tissue, most often in the milk ducts, with risk influenced by age, genetics including BRCA1, BRCA2 mutations, hormone exposure, and family history. Symptoms: a new lump or thickening in the breast or underarm, changes in breast size or shape, skin dimpling, or unusual nipple discharge. Survival rate: around 91% overall across all stages, rising above 99% when caught while still localized. Widespread mammogram screening is the single biggest reason outcomes have climbed steadily since the 1990s. Ovarian cancer, often called a silent cancer because its early symptoms are vague enough to be mistaken for far more common conditions. Cause: develops in the ovaries, with risk linked to genetic factors like BRCA mutations, family history, and the total number of lifetime ovulation cycles a person has had. Symptoms: persistent bloating, pelvic or abdominal pain, feeling full quickly when eating, and urinary urgency, all easy to write off as digestive issues. Survival rate: around 50% overall, but above 90% for the roughly 1 in 5 cases caught while still localized, almost entirely a diagnosis timing problem rather than a treatment problem. Cervical cancer. Cause: almost entirely caused by persistent infection with certain high-risk strains of HPV, the human papillomavirus, making it one of the few cancers with a direct, identifiable infectious cause. Symptoms: often none in the earliest stages, which is exactly why screening matters. As it progresses, abnormal vaginal bleeding or discharge can occur. Survival rate: around 67% overall, climbing above 90% for cases caught at the earliest, localized stage. Pap smears and HPV vaccination have driven a dramatic decline in cases in countries with strong screening programs. Endometrial uterine cancer, the most common cancer of the female reproductive system in developed countries. Cause: develops in the lining of the uterus, strongly linked to lifetime estrogen exposure, including obesity, since fat tissue itself produces estrogen. Symptoms: abnormal vaginal bleeding, particularly after menopause, is usually the first and most noticeable sign. Survival rate: around 81%, one of the more favorable outcomes among reproductive cancers, largely because that early bleeding symptom prompts faster diagnosis. Non-small cell lung cancer, the most common form of lung cancer, accounting for roughly 80 to 85% of all lung cancer diagnoses. Cause: smoking remains the single largest risk factor, though a meaningful percentage of cases occur in people who never smoked at all, linked instead to radon exposure, air pollution, or genetic factors. Symptoms: persistent cough, coughing up blood, chest pain, hoarseness, and unexplained weight loss. Survival rate, around 28% overall, rising to around 65% for cancer still localized to the lung. Early lung cancer frequently produces no symptoms at all, which is a major reason it's so often caught late. Small cell lung cancer, a less common but significantly more aggressive form of lung cancer, cause almost always linked directly to heavy smoking history. Symptoms, similar to non-small cell lung cancer, persistent cough, chest pain, shortness of breath, fatigue. Survival rate, around 7%, among the lowest of any major cancer, driven largely by how quickly it spreads before symptoms ever prompt someone to see a doctor. Mesothelioma, caused almost exclusively by asbestos exposure, developing in the thin lining that surrounds the lungs, abdomen, or heart, often decades after the original exposure. Symptoms, shortness of breath, chest pain, persistent cough, and unexplained weight loss, typically appearing only once the disease is already fairly advanced. Survival rate, around 10 to 15%. That long delay, often 20 to 50 years between exposure and diagnosis, is what makes this cancer so difficult to catch early, and remains one of the clearest examples of a cancer whose entire existence is preventable. Colorectal cancer, one of the most common cancers worldwide, usually begins as a benign polyp in the colon or rectum lining that can take years to turn cancerous, influenced by diet, age, family history, and inflammatory bowel conditions. Symptoms, changes in bowel habits, blood in the stool, abdominal discomfort, and unexplained weight loss. Survival rate, around 65% overall, rising above 90% when caught at the earliest, localized stage. Routine colonoscopy screening is unusually effective here, since precancerous polyps can often be removed before they ever become dangerous. Pancreatic cancer, one of the more difficult common cancers to catch early. Risk factors include smoking, chronic pancreatitis, long-standing diabetes, and family history, though many cases have no clearly identifiable cause. Symptoms, jaundice, yellowing skin and eyes, unexplained weight loss, abdominal or back pain, and new-onset diabetes. Survival rate, around 13% overall, though it climbs to roughly 44% for the small percentage of cases caught while still localized. Treatment options have slowly been expanding over the past decade. Liver cancer, most commonly develops in people with existing liver damage from chronic hepatitis B or C infection, or from cirrhosis caused by long-term heavy alcohol use. Symptoms, abdominal pain or swelling, jaundice, unexplained weight loss, and fatigue. Survival rate, around 21% overall, varying significantly depending on how much healthy liver tissue remains at diagnosis. Hepatitis B vaccination has become one of the most effective cancer prevention tools ever developed. Stomach gastric cancer, strongly linked to chronic infection with H. pylori bacteria, as well as diets high in salted, smoked, or preserved foods. Symptoms, indigestion, feeling full after small meals, mild stomach discomfort, and unintended weight loss. Survival rate, around 36% overall, though considerably higher in countries like Japan, where endoscopic screening is far more common and cases are caught earlier. Esophageal cancer develops in the tube connecting the throat to the stomach. To very different primary causes depending on location: chronic acid reflux damaging the lower esophagus, or smoking and heavy alcohol use damaging the upper esophagus. Symptoms, difficulty or pain when swallowing, unintentional weight loss, and chest discomfort. Survival rate, around 20% overall, reflecting how often this cancer is caught only after the tumor has already grown large enough to narrow the esophagus significantly. Prostate cancer, extremely common in older men. Risk rises with age, family history, and certain genetic factors, though the exact trigger in most individual cases isn't identifiable. Symptoms, often none at all in early stages, which is why screening PSA testing plays such a large role. When symptoms do appear, they can include urinary difficulty, blood in urine or semen, or pelvic discomfort. Survival rate, around 97% overall, close to 100% when still confined to the prostate. Many prostate cancers grow so slowly they never become life-threatening, leading to real, ongoing medical debate over which cases need aggressive treatment versus careful monitoring. Bladder cancer, strongly linked to smoking, which is responsible for roughly half of all cases, since carcinogens filtered through the kidneys accumulate in urine and sit in direct contact with the bladder lining. Workplace exposure to certain industrial chemicals is another recognized cause. Symptoms: blood in the urine, often painless, along with frequent urination or a burning sensation. Survival rate: around 78% overall, and higher still when confined to the bladder lining, though this cancer has a notably high recurrence rate even after successful treatment. Kidney renal cell cancer. Cause: risk factors include smoking, obesity, and high blood pressure, though many cases are discovered completely by accident. Symptoms: blood in the urine, a lump or pain in the side or back, and unexplained fatigue or weight loss. Survival rate: around 78% overall, rising above 90% when caught. While still confined to the kidney, early-stage kidney cancer frequently produces no symptoms at all, which is why so many cases are picked up incidentally during an unrelated scan. Testicular cancer, relatively rare overall, but the most common cancer in young men between their late teens and mid-30s. Cause: linked to undescended testicles at birth and family history, though the precise trigger remains unclear in most cases. Symptoms: a painless lump or swelling in the testicle, a feeling of heaviness, or dull ache in the lower abdomen or groin. Survival rate: above 95% overall, approaching 99% when caught early, one of the most treatable cancers in all of oncology, responding exceptionally well to chemotherapy even after it has spread. Leukemia, not a single disease but a group of cancers affecting blood-forming tissue. Cause: arises in the bone marrow, with risk factors including certain genetic conditions, prior chemotherapy or radiation exposure, and exposure to certain industrial chemicals like benzene. Symptoms: fatigue, easy bruising or bleeding, frequent infections, bone pain, and swollen lymph nodes. Survival rate: around 65% overall, though this varies enormously by subtype. Childhood acute lymphoblastic leukemia, for example, now has survival rates above 90%, while some adult forms remain significantly harder to treat. Hodgkin lymphoma. Cause: develops in the lymphatic system, identified by a specific abnormal cell type, the Reed-Sternberg cell, under a microscope. Risk is linked to certain viral infections like Epstein-Barr virus and a weakened immune system. Symptoms: painless swelling of lymph nodes in the neck, armpit, or groin, along with fever, night sweats, and unexplained weight loss. Survival rate: around 89%, among the highest of any cancer covered here, and often cited in oncology as a model case for how far cancer treatment has advanced. Non-Hodgkin lymphoma, a broader, more varied group of lymphatic cancers than Hodgkin lymphoma. Cause: linked to immune system dysfunction, certain infections, autoimmune conditions, and in some cases environmental chemical exposure. Symptoms: swollen lymph nodes, fatigue, fever, night sweats, and unexplained weight loss. Survival rate: around 74% overall, though individual subtypes range from over 90% to considerably lower depending on how aggressively the specific lymphoma behaves. Multiple myeloma. Cause: a cancer of plasma cells within the bone marrow, which normally help produce antibodies to fight infection. Risk increases with age and is more common in men and in individuals of African descent. Symptoms: bone pain especially in the back or ribs, fatigue, frequent infections, and unexplained fractures. Survival rate: around 58%, a number that has risen substantially over the past 2 decades thanks to newer targeted therapies. Glioblastoma, the most aggressive and most common malignant brain tumor in adults. Cause: no clearly identified cause in most cases, though prior radiation exposure to the head is one of the few confirmed risk factors. It is not caused by cell phone use, despite persistent public belief otherwise. Symptoms: persistent headaches, seizures, memory problems, personality changes, and progressive neurological deficits depending on which part of the brain is affected. Survival rate: only around 5 to 7% at 5 years, with median survival typically measured in months. It remains one of the most researched and least improved cancers in modern oncology. Meningioma. Unlike most entries on this list, the majority of meningiomas are benign rather than cancerous. Cause: develops in the membranes surrounding the brain and spinal cord rather than in brain tissue itself. Risk factors include prior radiation exposure and, in rare cases, certain genetic conditions. Symptoms: headaches, vision changes, seizures, or subtle personality and memory changes depending on the tumor's size and location. Survival rate, excellent for the majority of cases, which are benign and slow-growing. Considerably lower for the small percentage that are malignant. Thyroid cancer, one of the more survivable cancers overall. Cause, risk includes prior radiation exposure to the neck, particularly in childhood, family history, and certain inherited genetic syndromes. Symptoms, a lump or nodule in the neck, often found incidentally during an unrelated exam, along with occasional voice changes or difficulty swallowing in more advanced cases. Survival rate, around 98%, among the highest of any cancer on this list, though a smaller, more aggressive subtype called anaplastic thyroid cancer behaves very differently from the more common forms. Oral cavity cancer. Cause, historically linked most strongly to tobacco and heavy alcohol use, though HPV-related oral cancers have become an increasingly significant cause in recent decades, particularly at the back of the throat. Symptoms, a persistent mouth sore that won't heal, unexplained mouth pain, difficulty chewing or swallowing, and a lump felt inside the cheek or on the tongue. Survival rate, around 68%, depending heavily on how early the sore or lesion is noticed and evaluated. Osteosarcoma, the most common form of bone cancer, disproportionately affecting children and teenagers. Cause, typically develops in the fast-growing ends of long bones like the femur or tibia, right around the same growth plates responsible for a teenager's growth spurt. Symptoms, persistent bone pain and swelling, often mistaken for a sports injury or normal growing pains. Survival rate, around 60 to 70% for localized disease, dropping significantly if the cancer has already spread to the lungs by diagnosis. Soft tissue sarcoma, a broad category of cancers arising in muscle, fat, blood vessels, or other connective tissue, with more than 50 recognized subtypes that behave very differently from one another. Cause, in most cases no clear trigger is identified, though prior radiation exposure and certain inherited genetic syndromes raise risk. Symptoms, a growing lump or swelling, sometimes painless at first, that can develop almost anywhere in the body. Survival rate, around 65% overall, varying enormously by subtype, tumor size, and location. Neuroblastoma, a cancer that develops almost exclusively in young children. Cause, arises from immature nerve cells left over from fetal development, most often in the adrenal glands, with no clearly identified external trigger in most cases. Symptoms, an abdominal lump or swelling, bone pain, unexplained fever, and in some cases dark circles around the eyes caused by tumor spread. Survival rate, around 80% overall, ranging from over 95% in low-risk cases to considerably lower in high-risk ones. It's notable for its unpredictable behavior. Since in infants, some tumors can spontaneously shrink or mature into harmless tissue without aggressive treatment.